and welcome to CATSweek. I'm Annalise Poorman. At the Bloomington Board of Zoning Appeals September 23rd meeting, the board approved zoning for a home occupation on Arlington Road. According to attorney Vince Taylor, his client, Robert Itarola, has been running a pallet business from his home. He said that none of Itarola's neighbors have any complaints about the business. Development Services Manager Jackie Scanlon informed the board on the delivery variance that Itarola petitioned for.
Deliveries aren't allowed for home occupations outside of typical deliveries that you would receive on a residential parcel. So the types of residential delivery services that are typically used for residents are allowed, but nothing outside of that. So he's requested a variance to that because he receives roughly 70% of the pallets that he recycles are delivered to the site, and then he picks up the other 30%. So that is why he has requested a separate variance, because that is something that he is not sure that he can meet under his current operation. So those are the conditional use standards, and that are specific to home occupation.
Petitioner Robert Itarola commented on why he believes his home occupation should be allowed to continue.
I think Bloomington needs a pallet, someplace to recycle pallets. I think the businesses. I don't think we need to keep dumping pallets in the landfill. I really don't. I don't think we need to keep tearing down trees because cities might be narrow-minded about having someone recycling pallets in their town. I know they can be obtrusive, but I'm trying to keep it as aesthetic as I can. And I insist on pristine, and I really do. I just wish you guys would work with me on this. I've put a lot of time, a lot of years into this. It's taken a while to build up a nice business.
The board approved the petition unanimously. The next Board of Zoning Appeals meeting will be on October 21st. The Bloomington City Council continued the process of annexation at their September 22nd meeting, where they voted in favor of the annexation of Area 1A. Council member Steve Volin remarked on individuals who are against annexation. He emphasized that they are already a part of the community.
This ordinance is striving to do the very thing that many people who are objecting to it claim that they want to be part of. They say that they're part of this community, but here is the community moving to make them a part of the community, and they don't want to become part of the community. We're not trying to annex Smithville or Harrodsburg or New Unionsville. We're trying to annex areas where people say they live in Bloomington.
Councilmember Isabel Piedmont Smith addressed the concerns of the individuals who have made public comments throughout the annexation process. She outlined what the annexation would and would not do for residents in the area.
What annexation will not automatically do, and this, I think there's a lot of misconceptions out there. So annexation will not make you convert from septic system to city sewer. You only have to convert to sewer if and when your septic system fails, and if you live within 300 feet of an existing sewer line. It will not automatically install sidewalks on your streets. We have a long wait list for people who are in the city already who want sidewalks. So we will, base those considerations mainly on safety concerns. It will not automatically install streetlights on your streets. If you do not want streetlights, then the city will not, and Duke will not enter into an agreement to provide you with streetlights. It will not allow unrestricted development next door to you. You're not going to have high rises showing up in your backyard. The city has strict development regulations in its Unified Development Ordinance that protect both the environment and existing residential neighborhoods. After annexation is decided for certain, the City Planning and Transportation Department will hold public hearings on what zoning districts will apply. Annexation will also not automatically bring a bunch of rowdy students into your neighborhood. Students prefer to live closer to campus, and that's already within the city limits. Just a few things that annexation will do. It will make it possible for bus service, including BT access service, which is for people with disabilities, to extend to your neighborhood. It will provide hand rental inspection services for all residential rental properties, which is a safeguard for tenants. It will provide city maintenance and snow removal for streets. It will allow for our community to develop in a cohesive way and for us to plan in the long term all of the development that is adjacent to our current city limits. It will allow people in the annexed areas to eventually vote for the city representatives who make decisions that affect your everyday lives. The 9 of us here, the mayor, the city clerk. And finally, it will make you all part of the community that you already call home. Many people who live outside the city limits, if they go anywhere else in Indiana or traveling, they'll say, I'm from Bloomington. Well, let's make it official.
The council voted 6-3 in favor of the annexation of Area 1A. The next Bloomington City Council meeting will be held on September 29th. At their September 23rd meeting, the Bloomington Historic Preservation Commission discussed a request for new construction in the Restaurant Row Local Historic District. Commission member Jenny Southern explained the problems she could see with the proposed construction.
I would agree that I really don't like that open bay, big concrete bay. Nothing about that says it should be in a historic district. I would prefer they had no parking at all to that. Also, I'm not sure if the builders are going to listen to us at all, because I know the siding on the previous building was not only the wrong size when they redid the one in front of this one, but is also a weird, shiny, printed something.
The construction would include 2 4-bedroom apartments at 412 East 4th Street. Hand staff member Eddie Wright supported the project.
So we can make suggestions. This fits the guidelines. In fact, we set precedent by approving the building next door. So I think that we can ask Doug about the siding and ask that they do that. But otherwise, I think that this does fit in. They're not trying to make this look old, nor should they. So that's why I'm supporting this project.
The motion to approve the construction with the condition that the petitioner add 4-inch siding was approved 7-0-1. The next historic preservation meeting will be on October 14th. And we'll have more CATSweek after this message.
Do you know that thousands of children go without school supplies every day? Teachers Warehouse is a 100% volunteer-powered organization. We service the educational and creative needs of students in Monroe, Brown, Greene, Lawrence, and Owen counties by distributing school supplies free to the teachers. Teachers Warehouse is composed of 7 rooms filled with books, pencils, paper, and even tools to motivate students. If it's in a classroom, we'll supply it. To donate new or gently used school supplies or volunteer, give us a call at 812-929-7522 or email us at contact@teacherswarehouse.net.
Welcome back to CATSweek. The Monroe County Board of Health extended the local mask mandate until October 31st at their September 22nd meeting. During public comment, Dr. Colin Elliott asked the board to consider adjusting the mask mandate to accommodate his son Ruben, who he says is diagnosed with social pragmatic communications disorder.
Ruben is exempt from the mask mandate. The mask mandate makes it clear that Ruben doesn't have to wear a mask, but the mandate as written still discriminates against Ruben because his teachers and his classmates cannot remove their masks when in a classroom setting or another indoor social setting. And let me just repeat that because I think it's important to understand, because there are thousands of children like Ruben. To create an environment which is inclusive of my son's disability and the thousands of children like him with whether it's social pragmatic communication disorder, dyslexia, autism spectrum disorders, other communications disorders, other people around him must be allowed to remove their masks. So I guess I'm just asking the question, what is the county going to do to ensure that the mask mandate does not discriminate against my son as it currently does? The county's vision of public health must include my son. It can't just be about protecting my son from COVID. It has to be about my son's development as a whole human being. And so I just ask you to adjust the mandate in some way so that his present and future socialization is not harmed. And if you're unwilling to abolish the mandate, I understand that politically that's difficult. I do ask you to perhaps give schools discretion to apply it in ways which best fit their students.
Board member Carol Talukian later said she empathized with Elliot's situation. However, the number of COVID-19 cases is still too high.
I have huge amounts of empathy for you. I really, really do. But I think sometimes we just have to do what we can do to adapt outside of that. I mean, there's a whole rest of the day to work on issues, and I do appreciate it's a problem for him. I really do. But I think that, you know, and I don't think it's practical to have the whole classroom wear a face shield. I think that's not practical. And it's not right. I mean, he's exempt from the mask, but that's not the issue with him. He needs other people to be able to see their facial expressions. And I just hope you can do lots of therapy outside of school and work with them. And I can't hear you because you're muted. You know, but
I'd like to hear some thoughts. I don't want to jump in though, but
yeah. So anyway, but I don't think at this point, I don't feel, as much as I have empathy for you, I don't feel we can make, and I understand your argument completely. I don't think we're in a medical situation, a public health situation that we can do anything about it right now.
Board member Ashley Craner expressed her preference to extend the mask mandate. She said that the numbers of COVID-19 cases were not in a range where she felt comfortable letting the mask mandate expire.
We're looking at really another 30 days, another month of this. And if we can, in 30 days, we got to beat this pandemic somehow, or we're all going to be wearing masks, I think, forever and ever. And we might very well be, but I just, the people that are getting sick and dying are concerning for me. And also everybody's frustrations with all of this is concerning to me. And I truly hear you and the people that want to enjoy their church services and get that full effect. I understand that. But I think the board, I guess after hearing Margie talk a little bit more, I wish we could just give exemptions and make everybody feel better right now. But for me, I think I'm just gonna probably just stick to the next, probably will be voting for the mandate just to stay in as is for till the end of October. And hopefully we can see our numbers improve around here and throughout the state.
According to Health Director Penny Caudill, the mandate could be shortened if the number of COVID-19 cases decreases into the blue advisory category before October 31st. The next Board of Health meeting is scheduled for October 7th. At the Bloomington Board of Public Safety meeting on September 21st, Fire Chief Jason Moore shared that the Bloomington Fire Department has improved its public protection classification.
Because it's really big news, I did want to mention that our department did receive an upgraded ISO score of 1, which puts us as the 4th community in Indiana and the only city in Indiana that has that designation.
Moore also reported on flood damages incurred at the station due to flooding in June and noted that they are considering alternative locations for the fire station in the future.
We are now focusing back into the flood claims. We are also evaluating potential site locations for a new fire department headquarters or a new fire station because we did receive mold reports back, which only adds to the list of issues that structure had. So that is something that we will be looking at, and you will probably be included in that, the findings of where and the next stages for our department. Obviously, that will be some pretty big expenses. Because we have an engineer report that shows 4 of our stations now need to be replaced, we are in a pretty good position to start requesting federal money towards some of those projects, which is our intention.
The board unanimously approved funding to fix the flood damage. The board also approved a disciplinary decision for a staff member who violated fire department rules when they brought a firearm to the station. The disciplinary motion to suspend staff member J.D. Scott for 6 months without pay and to move him to a different station and shift. It passed unanimously. The Monroe County Commissioners heard the Seven Oaks Classical School face mask appeal at their September 20th meeting. According to Commissioner Julie Thomas, the citation for not complying with the county mask mandate was issued on August 19th, 2021. Seven Oaks then filed an appeal on August 26th. She shared that the appeal was based on 3 points.
Point 1, the enforcing of the health order would have an adverse impact on students who are experiencing a disability and those who are facing potential disability. Point 2, the compelling interest in education, maintaining the emotional and social well-being of students, as well as maintaining a health partnership with parents justifies deviation from the health order, and that school 2022 COVID protocols ensures public health. And point 3, that the emergency health order does not apply to schools.
Headmaster Dr. Stephen Shipp provided various reasons for why Seven Oaks should be exempted from enforcing the mask mandate surrounding the well-being of the students and the impact that masks have on their ability to learn.
Our concern for well-being extends not only to the physical health, but also to the social and emotional health of our students. This compelling interest, together with the evidence for the negative impacts of prolonged mask wearing on students' academic, physical, psychological, and social emotional well-being, and the limited effectiveness of masks in a real-world school environment, suggests that it may be reasonable to grant the school's appeal.
County Attorney Margie Rice questioned Dr. Shipp about the school's collaboration with the Board of Health and whether or not there had been any communication between the school and Health Director Penny Cottle.
I will concede for the record that people with disabilities, there's an exception written into the local health regulation to give an exception for people with disabilities who have speech or hearing impairments. Let me ask you, and that's certainly an exception that you could take advantage of, and those children with legitimate speech and hearing limitations would not have to wear a mask. Have you ever tried those clear surgical masks? Those surgical masks with a clear opening so that kids can see, a mouth moving, or the teacher can see the child's mouth moving. Have you tried those at your school?
Some have.
And Penny Cottle, correct me if I'm wrong, didn't she send you information about those masks?
She recently did, yeah. Mm-hmm.
Yeah. Now, is that something that you think you could implement in your school that would help both to help you comply with the mask mandate if it stays in effect, and be able to, is that a workable solution to that problem?
Shipp asked Cottle whether or not Seven Oaks had reported a distinctly higher rate of COVID-19 cases than other schools. Cottle said that the school had not. The commissioners decided they needed more time to review all of the information provided. A final vote and written decision will be made by October 5th. And we'll have more CATSweek after this message.
For hurting families in Monroe County.
A contribution to children who are vulnerable and in need of an advocate.
A staff that goes above and beyond to support and advocate for children in need of services.
The web of remarkable people who are dealing with difficult situations.
So many young people that are in need of help and trying to find a stable family, a stable place to live. Without the CASAs to make that happen, many of them would be unable to find a good home.
I love being that voice for the child who can't speak for themselves in court.
It takes me out of my comfort zone, and it also helps others.
CASA means supporting our community.
being a CASA is making sure that your village is healthy and whole, and that the children in your village will someday be able to help the village as well.
A child who doesn't have a voice, maybe in their family situation or a school situation, now has a voice that can advocate for them.
I really enjoy working with children that are going through difficult times and letting them know that I care about their future.
We are privileged with our charge of representing the best interest of children. And so therefore we can advocate for exactly what they need without restriction, focusing on their best interest.
I want to repair the world one child at a time.
Welcome back to CATSweek. At the September 20th meeting of the Bloomington Redevelopment Commission, Director of Housing and Neighborhood Development, Brent Pierce, issued an announcement on behalf of the Rental Assistance Program.
I do want to mention, I'm trying to make sure I mention this at every meeting I'm at, but if anyone knows, we are really trying to get the word out on the rental assistance program that the state has. So if any of you know someone who is maybe delinquent in their rent, or a landlord or property manager who has delinquent tenants, please send them our direction. We can get them routed into the system for the state emergency rental assistance program. This is something that's really important. There's lots and lots of money out there to help people with up to 12 months of rent as well as utilities. So we don't award that money from hand. It's a state program, but we can give them the information they need to apply and talk them through the process a little bit. But getting the word out here in Bloomington and Monroe County is really, really important.
Assistant City Attorney Larry Allen shared the plans for purchasing a parcel of land near the hospital. The property is located at 605 South Madison Street.
As you all know, you authorized an offer to the owners of 605 South Madison, which is part of the Bloomington Hospital Reuse Phase 1 East block, essentially, that's getting redone and was part of the master plan. The good news is the sellers accepted that offer for $265,000. This would allow us to purchase a key parcel that's right in the middle of that Phase 1 East development and actually save us some cost on some of the infrastructure redevelopment, because this particular parcel sits a little lower to build retaining walls all the way around it had we not been able to obtain it.
The purchase was approved unanimously. The next Bloomington Redevelopment Commission meeting will be held on October 4th. At the September 17th COVID-19 press conference, Monroe County Health Administrator Penny Caudill said that a new testing clinic will open on September 21st. According to Caudill, the clinic is the result of a partnership between the Indiana Department of Health and Gravity Diagnostics.
It is planned to open on Tuesday, September 21st. They will run initially Tuesday through Saturday from 8 to 4. It will be a drive-through to begin with, and they will be offering PCR testing with results back by 5 p.m. the following day. And the location will be at 500 North Profile Parkway. So that is where we had the previous drive-through at the beginning of the month, I think it was. It's Cook property, and we thank them for working with diagnostics, Gravity, to make this happen.
Caudill also reported that Monroe County is now in the orange COVID advisory category.
In terms of our advisory, and this is sort of the bad news, we had been holding steady at the yellow advisory. That changed this week. We went to orange. 200 cases per 100,000 and a percent positivity of 5.14%. Now, we almost stayed in yellow. 199 per 100,000 would have kept us in yellow. And so that was heartbreaking, but the reality is either way, we have a high level of transmission. And that's really the takeaway. I wish that I could tell you that I expect things to improve next week, but when I look at the numbers, and we had almost 70 cases documented today, I don't anticipate that our numbers are going to be less next week.
Co-chair of Indiana University's COVID response unit, Kirk White, shared that IU reported 79 positive cases this past week out of the over 600 symptomatic tests administered.
We continue to see a lot of our students who are coming to the Student Health Center with symptoms that may be COVID related, and they're checking those out. Last week we did over 600 symptomatic tests at the Student Health Center, but still had a very low positivity rate, which is very encouraging on a couple of fronts. One, the COVID's low rate of positives, but also it shows that our students are being very vigilant about making sure that if they have any symptoms, that they're getting them checked out. And that allows them to know for sure whether they're have COVID or not, and whether they need to be isolating and talking to their close contacts.
Journalist Dave Askins questioned Cottle on whether or not the increase in positive cases has been linked to the IU football games.
There certainly is a concern that, numbers dropped a little bit and then came back up across the state because of Labor Day activities and lack of testing over the holiday weekend, so that some of the tests may have been kind of scattered over time had we not had kind of a lull for the weekend and testing a little bit more difficult. We haven't had anything reported directly with the game, and keep in mind that the consensus is really outdoor activities are certainly much safer, and I know that masks aren't being worn outdoors, but even when it comes to distancing, masks are more important than distancing, for instance, when we're indoors. So I don't have an answer for you. I guess the short answer is I'm not quite sure. I will tell you that we are seeing cases still across all age groups, all areas of the county. So these are not just, they are definitely not just students. And as you just heard, IU's numbers are really very small in the scheme of things.
And that is all for CATSweek. Thank you for joining us. For CATS and WFHB, I'm Annalise Poorman.